Hello everyone, I am Dr. Vivek Venkatramani, consultant uro-oncologist and robotic surgeon in Mumbai. As we all know, many signs and symptoms of urologic diseases occur quite late, and there are early subtle signs which men often ignore. Being Men's Day, I thought that this would be a good time to re-emphasize some of these signs so that men can seek help early and allow early detection and a higher chance of cure of some of these illnesses. The most common signs include the first being hematuria or blood in the urine. This is never normal and should never be ignored. About 10% of patients who have hematuria turn out to have some form of urologic cancer, and that's why it's important to come to the doctor immediately and get this evaluated. Some other signs that are commonly ignored by men include a difficulty in passing urine, a reduction of the urine flow, waking up often at night, a sense that they haven't quite completed their urination and need to go more frequently. Sometimes they may even have to strain during passing urine, or their flow becomes interrupted and stops and starts again. These symptoms are generally associated with aging. Men above the age of 50 often have a growth of the prostate which is benign, and these can be some of the symptoms of this benign enlargement of the prostate. However, these symptoms also overlap with prostate cancer, and that's why it's important to come to a urologist, especially if these symptoms are quite persistent over a week or month, and get yourself evaluated and rule out any prostate cancer. Young men sometimes develop a lump in their testicle, which might be a sign of testicular cancer. Testicular cancer is one of the most common cancers in the age group of 20 to 40 years of age, which is a time when men feel almost invincible and as though nothing can go wrong in their health, and therefore they tend to ignore some subtle signs. A testicular examination by yourself is recommended every month or two. Just examine yourself in the shower, see if there is any difference between the two testicles, see if there is any growth or nodule that you feel, and that might be an early sign of a lump or growth on the testicle, which then needs to be evaluated by your doctor. So any man who has these symptoms, especially if they are persistent over a month, should come to a urologist to get checked. What we do during this checkup involves a detailed history of your problem. Then I would examine you and probably prescribe certain tests which will help to reach a diagnosis. The tests generally are fairly straightforward. We do some urine examination. We may check the urine flow in a special machine called uroflowmetry, and we will get a simple ultrasound to look for the kidneys, the bladder, the prostate, and also how much urine is remaining inside once urination is complete. If we are worried about a testicular lump, an ultrasound of the scrotum and testicular regions will be recommended. For men who have had blood in their urine, a CT scan is essential to rule out any urologic malignancy. Again, all men above the age of 50, we would recommend a simple blood test called the PSA, which will tell us if there is any risk of prostate cancer in that particular man. Once we have reached a diagnosis, then the treatment will depend on what exactly we find. So I would encourage all men that your body tends to whisper before it screams out when the symptoms and the stage of the disease is quite advanced. Therefore, don't ignore initial signs and symptoms, and please seek help early, because that would be the ideal way to catch things and nip them in the bud and lead a long and productive life after successfully treating whatever illness that may appear. On this Men's Day, I would urge you to share this video with all the men in your life, and if you found this video informative, please like and subscribe to my channel. Thank you.